My name is Jose Rojo, and I practice medicine in Spain. That's where I did most of my studies, and this was published in 2013 in the Journal of Ultrasound and Medicine. Ultrasound-guided carpal tunnel release. We call it ultra-minimally invasive surgery, and we defined ultra-minimally invasive procedures as the one performed through a 1 millimeter incision. I was visiting events in which the people bring different ship models to see which one they like best, I guess. It's kind of like a competition. I mean, it was amazing to see all the level of detail on those models. And then I turned around and got into another room, and I saw that there were people that were doing the same models, the same difficulty inside bottles. And I thought, oh wow, I mean, this is what we need for surgery. I mean, we need to be able to build that inside the bottle. We need to be able to do what these guys are doing, to work through that small hole and see through a solid media so that we can build and work inside. And thinking about when I was walking out of that convention, I thought, well, okay, so let's think about the technology we have nowadays. What could make the skin be transparent? And that's where the ultrasound thing came up. I'm here today because I fortunately know Dr. Cobb, first professionally, because all of our research in carpal tunnel syndrome is based on his concept and his description of the anatomy of the carpal tunnel. And it happens that on my right hand, I have a carpal tunnel syndrome. I've been suffering this thing for now 6 years, and I'm the worst possible patient. So I've just been pushing it and thinking, okay, perhaps I'll think about it tomorrow, but it's now affecting me. So here we are. We're going to do it today. I'll be assisting him, and so that we'll be surgeon and assistant with the same patient.
I've been watching ultrasound for quite some time, and I felt like it wasn't really ready, at least from a procedural standpoint yet. But last year I had the opportunity to co-moderate a course at the FISH hand meeting in Milan, Italy. And I went to Dubai to see his ultra-minimally invasive carpal tunnel release. And Jose's really perfected the technique, and so much so that he's able to do a carpal tunnel release through a 1 millimeter incision. And so he was here for the Academy meeting in Orlando a few weeks back, and was visiting some family in Texas, and flew up from Dallas, and we released his carpal tunnel here. So the long and short of it is, I really feel that ultrasound is now ready for the main scene. In the same way that the arthroscope allowed for minimally invasive procedures years ago, I believe that the ultrasound is going to take minimally invasive surgery to the next level.
I need to expect what I see on our patients, and also what we've been publishing. This is a procedure that is taking 3 to 5 times less for functionally being recovered. We're using the hand for most daily activities. It's 5 times faster than a mini open incision, which is a 1 to 2 centimeter incision. And for fully lifting weights, it's 3 times less. So I know that I should expect this margin, I mean 3 to 5 times faster recovery. And also, I mean, with this kind of procedure, the incision is very small, so I just should need a sticking plaster, and I always tell my patients to do all of their normal activities even after surgery. So I never restrict them from trying to lift that chair or using a keyboard, even just right after surgery. And so I always tell my patients, and I tell myself now, that I'll be able to do all that I can. This means I can wonder if I'll be able to keyboard. The answer I tell my patients, I mean, the way I tell my patients to answer that question is just try to do it. If you can, just do it. If you feel some pain, wait till tomorrow and try again. But the operation should not be restricting me for trying to do it or for doing it. It will be driven by the amount of pain. There's patients that have a little bit more pain or have more pain. Some others have no pain. So I've seen both extremes, and the average, as I say, is 3 to 5 times better in function pain recovery. Yeah, that's it.
Okay.
And now we put a straight strip. So
That was
that's it.
easy enough, huh?
Well, now it's been 10 to 15 minutes since we did the procedure. The tip of my thumb was a bit numb because that was the way it was for the past months, and I cannot feel that numbness anymore in the tip of it. And the right, the index wasn't completely normal either, and intermittently, of course, it was very numb. And now I'm not able to find that spot either. So far, 15 minutes late after surgery, I'm part of the lucky guys that feel much better sooner. It's not what happens always. It's been now 72 hours since Dr. Tyson Cobb and myself, we operated together on the same patient, which was me, myself. This is what the wound looks 72 hours after the operation. And we can see there's basically no signs of hematoma. The wound is around 1 millimeter, and there's no pain when I touch or when I press. There's a very mild pain here when I press deeply. This is a curve, I would say, that's been going on with pain at rest on the first 3 days. For the first 36 hours, perhaps a bit longer, almost 2 days, I was having intermittent pain that would be in between 0.5 and 1 out of 10 on a scale of 10. And I started doing 1, 2, 3, 4, 5. I can feel some pain. There's still like 2 out of 10 probably pain-wise. But there's something else quite nice to see, that you can do this with this kind of operation. And of course, you cannot do any of this with a standard operation. I don't see a way to do it without being safe, you know. But if you wanted to take the bar like this and do pull-ups, I feel that there's basically no pain for doing all these pull-ups I'm doing. So it's probably 0.5. But I feel that fortunately the operation is standing all this stress test, and that I'm basically very happy as a patient. So I sincerely feel that the operation, the way we designed it and the way we implement it, it makes a large difference with previous operations. Especially when, in my case, I don't know if you can see it here, I had a previous accident and I had my carpal tunnel release. It was a large release, and it was due to another injury. It wasn't because of a carpal tunnel itself, but I really felt that this was painful. It's not the same as this time with this thing. So that's basically it. Thank you very much. We may meet in another occasion.